Welcome to Something to Talk About at the Bainbridge Island Senior Community Center. Very happy to have you all here. Today we are going to talk about a continuing topic of great interest on Bainbridge Island and across the world, which is COVID vaccinations. And it's proven to be a challenging and frustrating experience. We have on Bainbridge Island a great collaboration of folks who are doing everything they can to get vaccines into people's arms, but it has proven to be a challenge for sure. I'm very happy to have Ann Lesage from the city of Bainbridge Island here, Lauren Bast from Bainbridge Prepares. I think we might hear from Mark Tan of Bainbridge Island Community Pharmacy. We'll hear from Island Volunteer Caregivers Executive Director Laura Van Dyke. Also involved the Bainbridge Island Fire Department and the Medical Reserve Corps, a group of volunteer doctors and nurses and other medical professionals who are all coming together to try to respond to the challenges of the administering of the COVID vaccine. And I think I'll just start with Lauren Bast, who's the Executive Director of Bainbridge Prepares, which has been sort of the coordinating organization. And so maybe you can just give us an overview of how things are going and what challenges you're facing. Just unmute yourself and away you go.
Well, thank you, Reed, and thank you, everybody. So I actually forgot to prepare completely updated numbers for this call, but I believe since December 23rd, we have, so just, about 5 weeks ago, we have vaccinated, we being the partnerships that you mentioned, Reed, have vaccinated probably 2,300, 2,400 people in Kitsap County and Jefferson County. So many of you have seen our website. Not the prettiest thing in the world, but it works, where you can sign up for appointments, well, when they are available, on either Bainbridge Island or Chimacum currently up in Jefferson County. And so as appointments become available, we add them to the website, and you're free to book if you are in an eligible phase. One thing I'd like to, I don't know if this is the appropriate time to say this, but I'd like to give a thank you to every one of you that has not received the vaccine yet and has been patient and has only called Reed or Mary 4 times and not 9 times to ask, how can I sign up for an appointment, and what's taking so long, and all that. You've read all over the place about how difficult it can be to get an appointment, and it's we are not unique. It's not like we are trying to hide appointments from you. Like right when you're about to click on a link to sign up, then we take it away and we laugh and twirl our mustache. Or I don't have a mustache, but I twirl Reed's mustache when I'm around him. It's really a matter of we don't have enough vaccine, and we are trying to use the vaccine that we have to get it into what we as sort of a community of partnerships determined to be the most in need. And there's this quick story I'll say how that has translated in terms of keeping people from getting sick, keeping the most vulnerable from getting sick. So many of you are probably aware that Madrona House on the island has been going through a COVID outbreak currently. And we vaccinated, I want to say about 70 Bainbridge Senior Living employees across Madrona House and Madison House and Wyatt House. First on Christmas week, and then maybe about 10 folks every week thereafter. And about 3 weeks ago, we were able to vaccinate 110 residents in the homes in Madrona and Madison on site. And last week, one individual, was tested positive. One resident tested positive for COVID, and
And
it
I'll
spread.
just add that this has been like, I know Bainbridge Senior Living has been doing everything they can to try to take care of all the safety measures they can, and so that this would
Yep.
happen, of course, it shows the virility of this COVID. So,
And yes, it's just pure bad luck. I mean, they've escaped the worst for the last year, and Morgan and her team have done an amazing job keeping everyone safe. But it's just a matter of this pesky virus just can get you from anywhere. And so, essentially, we vaccinated probably total of 200 staff and residents of Bainbridge Senior Living. And last night, and I'm not jinxing this by mentioning, but given that we had given their residents, we had taken 110 of those doses and given their residents, basically 3 weeks of lead time and getting their immunity kind of able to fight off the virus. Every one of the cases that they've had so far are either asymptomatic or very mild, basically cold-like symptoms. So yes, they were able to catch the virus, but no serious issues so far. And of course, I don't have a crystal ball to essentially say, if we didn't get those 110 vaccinated, how many serious issues would have come up. But the fact that we were able to kind of very deliberately, target them and get 100 and 200 of our doses to them 3 weeks ago and 4 weeks ago, instead of to a few of you that may not, still not be vaccinated in this call, maybe prevented a lot of illness and or worse results. And so, the fact that many of you are patient and hearing about neighbors that are getting a vaccine, either from us or from St. Michael's or somewhere, and still saying like, okay, I can wait a little, I can wait another week or 2 weeks or 3 weeks. We want to get to every one of you, but it's just a matter of it's very dependent on vaccine supply and numerous other factors. So we're trying, and I just want to say thank you to everybody that has yet to receive one.
now I'm going to pop in here and ask Anne to talk a little bit about what the how the city sees its role in helping to make this happen.
Yep. So I will talk a little bit about bigger picture, and then Lauren can help with some of the specifics of what we've been doing specifically with our partnership. So bigger picture, I know for those of you that heard me talk a couple weeks ago, some of this might be repetitive, but essentially what happens is, the state is receiving 100,000 doses per week, and they decide how to allocate to all of the different vaccine providers across the state. And so what is happening with us is this partnership between the city, the fire department, Bainbridge Prepares, and the pharmacy. We are notified on Sunday night how many doses are coming on Monday, and then we make our plan for setting up clinics for the weekend. But the bigger picture is that in general, there are not a lot of providers on Bainbridge Island. So Member Plus Family Health has received, a few hundred doses, and they're working through their patients and eligible, 1A and 1B1 folks. Virginia Mason Franciscan Health Clinic on Bainbridge Island has received some, but moving forward, they are not going to continue to provide vaccines at the Bainbridge Island Clinic. So they're not accepting any new appointments. And what that means is that there are no other places you can go on the island to get vaccinated. And so we petitioned the county to advocate on our behalf to get additional doses that would allow us to set up some high throughput mass vaccination clinics. So we've asked for 1,000 a week. I have no idea if we will get that approved, but we're working on that. But in the interim, what I'm trying to do and what our unified command is trying to do, which is, fire, Bainbridge Prepares, community pharmacy, and the city, is we meet every week multiple times to figure out, what's our plan, but also how can we share with the community where else you can go. because at this point, if we continue to get 100 a week, it's going to take us years to get everyone on Bainbridge. And so I'm going to put a link in the chat. And please, like Lauren said, for those of you that stopped calling or, didn't totally overwhelm us, I'm also going to put out a call. Share this information. When you see people ask questions, I cannot respond to every post on social media or every question that I get. And I really want you, and I know Reed has done a great job sharing this through the senior center distribution list, but share this with your friends, with your neighbors, with your church, with your book club. This is the only place you need to go for information on Bainbridge Island. If there are clinics, we will link to that website that Lauren talked about. If there's a mass vaccination clinic that ends up getting scheduled, we will share that. And then what I'm going to start adding onto that page is the link to other resources for mass vaccination clinics. So we might have folks that have to go to Seattle or have to go to Bremerton or have to go to Silverdale. And with Virginia Mason on the island changing their plan and not accepting any more doses, they are saying, all right, if you're a part of our system, you have to go to Silverdale or Bremerton. So it's definitely a challenge. Our promise to the community is every Monday, we are going to update that website. I presented to council last night, so we're going to provide updates to council. If there are available appointments through community pharmacy and through our partnership, we will send out a nixle. And mind you, if it's 100 or 200 appointments, they're going to go in a matter of minutes. And so we appreciate your patience. Like Lauren said, this is frustrating for everyone. The reality is, the governor said yesterday, there's 1.7 million people in our state eligible to get vaccinated. And if we're getting 100,000 a week, you can do the math. It's going to take a long time to get everyone vaccinated. So I just want to share that. Please know there are hundreds of people on the island working to get vaccine in arms, and we are truly doing everything that we can to serve this community.
Now, I want to just move to the folks who have the frustration of not being able to get online, because the way that people have been able to get an appointment is to go on CHI Franciscan or go on the Kitsap Public Health District website, or when we had vaccines here, to go on the Time Tap website that Lauren and team put up. But there are people for whom either they don't have internet connection or the challenges of dealing with the internet are overwhelming. And the Senior Center, and to a great degree, Island Volunteer Caregivers, has been working to try to meet that need. And Laura Van Dyke is here. And I wonder if you might be able to tell us a little bit about how you've been trying to identify those folks.
Sure. Thanks, Reed. Yes. That's the challenge, right? What do you do when you don't have an email address, you don't have an internet connection, you don't have family support, and you don't have transportation? This is a really daunting effort. So what IVC is doing, Island Volunteer Caregivers is doing, is we are maintaining a database with people's names, date of birth, phone, email, and address. And we're keeping track of people, and we're basically sorting by age. So we're doing this on behalf of Bainbridge Prepares and Community Pharmacy in the city, just to keep a list, because you're on our list doesn't promise anything, but it does give you an opportunity to at least to be on a list, which sometimes can feel very satisfying. We in partnership with the whole group, we were able to have a clinic this past Monday where we did have 120 people go through, which was really fantastic. Because it was sorted by age, and there was also some facilities that needed to be, their vaccines needed to be completed. The age range that we were able to help was still in the 90s. And we're hearing from people all the time to be added to the list. And we got a couple new hundreds and a few more 90s. So like what Lauren was saying, is we don't know how many doses we have. So what we're doing, if if you would like to be on the list, you're welcome. And I checked with staff before I'm offering this. You're welcome to call IVC 206-842-4441 and say you'd like to be on the list. We just need your first name, last name, date of birth, phone, email if you have it, and your address, and so we can contact you. And as we continue to prioritize by age and we hear from Lauren how many doses we have, we will work through the system as best we can. We're reaching out to people now. To churches are giving us lists of names that they're nervous about. These are folks that they get the bulletin mailed to them, and they know there's probably some issues, and our volunteers are fantastically stepping up, and we're giving them lists. We have a script. They're just saying, hi, we're from IVC. Do you have a plan? You know, if you have a plan, we're like, great. You go on our doesn't need our help list. So we still keep track of you, but we're not going to call you. And we're super excited, and we'll let you know. But if you do need help, then absolutely, we want you to be on the list. But to be honest, we're getting phone calls from people in their 67, 68, and I'm telling them, I'm happy to put you on the list, but there's a lot of people, literally hundreds of people ahead of you. So
well, and the other thing is that that if you have internet capability, if you are able to manage websites, you're probably going to be able to secure an appointment yourself more efficiently and more quickly by taking care of it on your own. I would like to go to that. And Lauren, I've had a lot of people ask me about the covidbi.timetap.com, which is the website that you're using to manage appointments. There's a button in the upper right-hand corner that says register. Should I use that button to register in advance? Does that do anything?
You're welcome to. It's neither bad nor good. You're welcome to if it saves you some steps whenever we do have available appointments. Yes, it's.
But otherwise, how would you take advantage of that website? Can you kind of walk me through that a little bit?
Yeah. So
do you want me to bring it up?
Sure.
Okay. So you can just talk a little bit about how that might work. Let me just do some present now magic here and see if it works out. There we go. So you should be seeing it.
Yep. All right. Again, not the prettiest website, but it's worked well so far. So we unfortunately, Bainbridge Repairs does not have the resources to maintain a large wait list. Thankfully, Laura and her team are picking up the slack there. But what you can do, so let's pretend that the state gives us 1,000 vaccines tomorrow and says, please get as many people signed up in the next week as possible. What you would see is, well, first I'd take that little red ugly thing to basically say, go away. I take that down. And you will click. And so right now we only have, public appointments for second doses, but you can kind of get the, idea of what the flow looks like. So I mentioned that we have 2 clinics, one in Bainbridge and one in Chimacum, designed to essentially, us to take care of mostly Kitsap County residents or people that work in Kitsap County, and then the Port Hadlock and Chimacum location again to supplement the Jefferson County efforts. Doesn't mean that we don't take a few folks from Jefferson and at Bainbridge or vice versa, but it's really designed to kind of keep the allocations 95% allocated within the county that they're in. So for Bainbridge Island, why don't you go ahead and click, Reed? So scroll up a little bit, and it kind of walks you through what we have available. So right now, for everybody, I mentioned we've taken care of probably 2,400 folks. About roughly about 1,600 folks at our Bainbridge Island clinic. So a lot of them are going to be due in the next few weeks for their second dose, their booster dose. So, they're coming up, they're seeing this, they click, click one more time. And this is sort of you're going to see a separate screening form if you're getting your first dose. Basically, make sure that you're eligible. If you're 33 years old and don't have any issues or whatever, and you're not in the right phase, we kind of tell you to no, save this for if we can't validate that you're in an eligible phase, we're going to turn you away. In this case, you're getting your second dose, and if you're except for rare circumstances, you're owed a second dose regardless of how you got the first dose. And so, you can see we've got one seat remaining for January. Reed, why don't you click on February? Because I know we have a number of doses available for February. So, you can go and
4 second doses, obviously. This is second doses.
Second doses only, yes, because we have very specific numbers of second doses that match the number of first doses that we gave out. So on February 6th, we have, 10 seats available. And you'd go and you'd say, well, 10:30 works better for me than 3:30. So I'm going to pick a 10:30 slot, and you can go ahead and click next. And then you can fill out your screening and your first and last name and date of birth and all that sort of good stuff. And, go down, and essentially we have a couple of required fields. So we absolutely need to know what your last name is. Yeah, but we may not need to know what your Medicare number is if you're not, over the age of 65. So, you kind of click through, and assuming, you answer all the questions properly, you get you're able to request an appointment. It doesn't mean you're confirmed yet. We have a team that essentially vets all the appointments we have coming into the system. So it's a team comprised of a few folks, a few volunteers, including with the fire department, that goes and says, okay, their story makes sense. Yep, I can tell they're a dental hygienist that's currently employed, or that I can tell by their birth date that they are 82. And so you save, and you hope that you get a confirmation email from us that says, congratulations, you've got an appointment. Or,
well, that point there that you just made, you got to wait for that email.
You have to wait for a confirmation.
Right, Lauren? You have to wait for that email before you know that you have an appointment.
Correct.
That was one of the things that kind of surprised people. The same tool is being used by the Kitsap Public Health.
Correct. We turn them on to the tool. They may not use it for very long. They were so overloaded that the same setup for them crashed, I think, in an hour after they publicized it. That's a little bit of a reason why I haven't been blasting out to multiple channels about this, because I don't want a dead website. But yes, so wait for the confirmation email. Hopefully get your email right, because we can't send you an email if you mess up your email address. We try to fix them if we can tell that you meant to put .com instead of .con. You switch the M and the N. So we try to look out for that, and then hopefully we get you scheduled and we get you a jab in the arm.
So in addition to in fact, this is linked from our website. In addition to the note that we heard from Ann, the Senior Center has a page about COVID-19 news that has links to most of these places, and including right on top is the page that Ann promised is going to be updated every Monday. I'm going to open the floor to questions, I think, if that's okay with everybody. I think we've covered the basics. Joan, would you unmute yourself, press the little, there you go, and ask your question.
Yeah, I have a question. The website that Ann, the link that she gave, I've used that, tried to get an appointment several times, and I just have a question about it. You have to go through a lot of information to see if you're qualified, and do you have to do that each time? And is there any proof that you've gone through that? Like, because when I got to a certain point, there was a conversation box that said, "Are you qualified?" And I didn't know what I was supposed to enter into that box.
Do you mean on TimeTap itself?
I don't. It's the
Is it the screen we just saw?
It's it's the one that the link that Ann posted. www.bainbridgewashington.gov, vaccine information.
So we don't have a survey. The state, are you thinking about the phase finder tool? That is the State
Yes,
Department
I
of
think
Health?
that's it.
Okay, so the
Maybe
good
that's
thing,
it.
and we haven't talked about this. So the Washington State Department of Health has a phase finder tool, and you do only have to go through, especially if you are eligible, that is a really good place to start, because what it does is at the end you get an email and a certificate that shows you're eligible in this current phase.
Okay.
And so that is something that certain mass vaccination sites want you to bring with you to prove your eligibility. And so if you go through and you do that, and then at the end, what it does, it brings up a list of all of the different vaccine sites in Washington State. So that find your phase read.
Yeah.
Yes. Yes, and I've done that, and I've gotten printed out my eligibility. But then when I go into it the next time, I seem to have to go through that whole process again. When I'm
Yeah,
just
you don't have to keep going back through it, because all it is doing is generating that proof of eligibility.
It's not getting you in line for an appointment.
Right. Okay, I just didn't know if I had to do that each time. It seemed like I kept getting directed to that to complete all that information again. But
Yeah, you just want to do that once.
okay, all right.
And Sheila Kerwin had a comment or question. Sheila, you'll need to unmute.
It would be helpful, wouldn't it?
Yeah.
Anyway, I got my first dose over here at Winslow Arms, and my little card says that I'm due for the 13th of February. Now, will I be getting that still here at Winslow Arms, or do I need to go to the senior center, or what? And how do I sign up then?
You want to answer that, Lauren?
I was gonna make Laura answer that. So Sheila, it was good to see you at Winslow Arms the other week. What we'll do is, Laura and I haven't formally talked about it, but what I anticipate is for all those offsite clinics, we're going to call it Groundhog Day, where essentially the same set of people are just going to kind of do the same thing at Winslow Arms or wherever it ends up being. If you're Madison House, do it at Madison House, where we go ahead and get you all taken care of for your booster on probably the Saturday of the 13th. So I don't believe you need to worry about any of that. I'm gonna shift responsibility to Laura and her team to get that clinic organized. But we will definitely have, well, assuming nothing unexpected happens, we will have your booster doses available for that Saturday.
So do I have to sign up or not, or does it just automatically happen for me here?
I can respond to this. So, Sheila, yes. If you're on our list as having your first dose at Winslow Arms, and so we have a pretty big database now, and we're keeping track of everyone who was vaccinated there, and we will be calling you to let you know that, once we hear from Lauren, what are the, do we have the doses? What's the day? All of that. We will then reach out to you. IVC volunteers will call you and let you know the details. It's going to look very similar to what we did on the 16th.
So if you are not at one of these group vaccination sites, then you will need to go back to TimeTap, just like we did with Lauren in the walkthrough, and schedule your own appointment. One of the things that happens when you go through with Bainbridge Prepares and the group at Medical Reserve Corps is that once you complete the appointment, you will get a reminder to go and schedule a vaccine as soon as you can after your sort of ripeness date. So the idea is that there should be about 28 days between when you get your first shot and when you get your booster. The doctors have said that you have a good amount of range after that point. If you can't get a booster on exactly 28 days, there's nothing wrong with that. You can wait. You can wait. It's okay. And it looks like there's been a pretty good job of setting up these booster appointments. And you can see that for people who had the first shot, Lauren has already got things scheduled. Michael, you have a comment or question?
Hang on, Reed,
Am I unmuted?
No, yes, you are.
Okay, good. Was there somebody else wanted to say something?
I just wanted to add one more comment on the second dose. So at this point, as it stands, it's an automatic shipment from the CDC. So I don't want anyone to hear, the like 100 a week that we might be getting. That does not include second doses. So at this point, like Lauren said, unless something changes, those are auto shipped. And we are working to map everything out so that we do as best as we can to hit that 28-day mark. And like Reed said, you can't do it any sooner than 25 days, but at any point after, you're still good. So I don't want people to be concerned if you're away or you're just not available that day. That's okay. We will
or there isn't an appointment that day if for some reason you can't find one. But you should go back to the same place that you got the first vaccine to get the second vaccine.
Yep.
Okay, Michael.
So my question, I think, is for Ann. With the Nixle notification, does that tell us where? I guess it tells us how many doses are available. Does it tell us where they're being administered?
Yes. So what we will do when we have a clinic planned is we will send out that Nixle alert. It will link to TimeTap. And it will tell you all the details of the clinic. Like I said, the challenge is going to be if it's only 100 appointments, that Nixle goes to 10,000 people. If, half of them are eligible, we'll probably crash TimeTap again.
Sure. All right. So what you're telling us is all of that goes through TimeTap are those appointments. And then we go to TimeTap to do the scheduling. Okay. That's what I wanted to know.
Thank you.
Okay, Lawrence or Bonnie had a question. Would you unmute yourself? And there you go.
Yes, we were in on Monday to sign up. We did a paper application at the senior center. Is there anything else we need to do other than wait?
That's a question for Laura. This is a couple that filled out a form. We have forms at the senior center that basically mirror what's online. And I collect those forms every day or two and send them to IVC, and they get put on the database. So Lawrence is asking, does he just wait? Will somebody call him?
Yep.
What's your advice?
Yep. Yeah. If depending on where you are, your age, like I said, we're right about working in the low 90s right now. So if you're in your 90s and you haven't received a call yet, well, then you can call. But if you're not, just know that we are sorting as we go. We just heard yesterday from Lauren how many people from our list that we have doses for. So it's unfortunately, I mean, this is for Friday. So we, it's not you don't get a ton of warning, but we will, as soon as we know, and as soon as we've sorted, and as soon as we've identified the folks with the numbers, we'll let you know that day. So we're letting people know right now for the few that we do have on Friday, and we'll continue the conversation with Lauren to see, how do these, how are the doses coming in? Is the shipment bigger? Can we do, can we do more sooner? Everyone that I'm talking to is on the same page where we want to get as many seniors done as possible, as soon as possible. And we also want all of you having your eyes and ears open for friends or people that you might have concern about, and kind of send them our way if you think they're going to need some help.
Yeah, we'd love to get through 1B1 as quickly as possible because there are a lot of teachers who are now at work, and we'd love to. I think they're 1B2. Is that right? So that would be the next group if we can get there. Yes, Lauren.
Although I'd like to say there are a number of teachers and bus drivers and folks that work at Ace Hardware that are 1B1s. And so, essentially we have, quietly reached out to some of those groups to sign them up. Essentially there's a 72-year-old bus driver that's going to be able to get their first dose and is not able to sit on a phone, because they're working. And so this is just kind of the tug that Laura and Reed and Ann and I have, say, okay, we have very limited available vaccines. How do we reach those individuals that are going to struggle otherwise to get the first dose, or may really, really need them because they're an essential worker that's also B1. How do we work that? So, anyway.
Okay, Hal, you had a comment.
You.
You need to unmute yourself, and then we'll be able to hear you. Go ahead.
Okay. Yes, I had some questions. So to make sure it's clear, we can register on TimeTap or whatever websites we can find. I think Safeway has some appointments possible in the future, and they will contact us when an appointment is available, or should we
No, so they
call back or
so the
check back?
situation so the situation is that you can't actually, I don't think anybody is running an appointment list in advance, a wait list essentially. You have to basically wait and watch these sites to see when there might be an available appointment, and then you nab it. It's a little bit like trying to get a rock concert ticket, unfortunately. And so, the Rolling Stones are very popular, and apparently so is Moderna. Katie, did you have a comment?
So if you're 1B1 with comorbidity, is there any? If you are 1B1 with comorbidities.
Yes. So I think that's what Lauren is talking about. The idea, Lauren and Laura, is the idea that there isn't a wait list. And so if you are capable of actually monitoring the websites yourself, you might be more efficient at responding when there is an available appointment. If you feel as though that's a challenge, IVC and the Senior Center are happy to take your information, but we're basically right now sorting on age. And maybe I don't know about the question of comorbidities or pre-existing conditions. Lauren, have you thought about that at all?
Reed, I'm not sure if you said Laura or Lauren, so I'll pretend it was me. But Hal, one of our issues is, I would say, and I hope this doesn't come out the wrong way, but Ann and I and Reed and probably Laura as well have received hundreds, if not thousands, of emails and phone calls of individuals in 1B that have comorbidities. And if we were, the reason we're on this call is we want to help everyone, but we are so busy actually administering the vaccines, getting the clinics up, all that we just don't have the bandwidth to maintain a list of individuals to email out to say, okay, we know that it's not just 4 individuals that have comorbidities, it's 4,000, on Bainbridge Island and Poulsbo alone. And so it's just very, very tough for us to essentially put you on any sort of list for early notification. And so that's why Ann's message about, if there is availability, look at your Nixle alerts. You're already sort of registered on TimeTap so that it's just easier for you to get that appointment instead of the other 3,999 people that are in the same boat.
And the biggest hope, Hal, is that the state will be more efficient in notifying people like Mark Tan at the Bainbridge Island Community Pharmacy about doses that are going to be shipped, how many doses are going to be shipped. I heard yesterday that the president is right now asking for the federal government to notify states 3 weeks in advance, which would then allow the states to notify people like Mark Tan 3 weeks or 2 weeks in advance, which would then allow people like Lauren to put up the schedule 2 weeks in advance, which would then make it much easier for you to see what's on the horizon rather than having to jump on the web 3 times a week or 4 times a week and hope that you don't miss it. So it's
3
patience,
times a
as
day.
Lauren said at the front end. It's really, unfortunately, we have to try to work on cultivating our Buddhist Zen natures right now.
I have a
Thank
question,
you.
but I've never been on a call like this.
Yes, go ahead, Christine.
So, and I didn't know how to raise my hand.
Well, I just see your hand up, so I'm going to say you got it up. Go ahead.
Okay. So I've gotten my vaccine, but I'm trying to help a lot of other people. So I just want to make sure I understand. Virginia Mason is out of the picture now. There's no wait list to add your name to, which some people think they're on, they're waiting.
So
That's gone, right?
according to, and I'm definitely going to verify this, but this is directly from one of the doctors who works there, that they are stopping that wait list and they're going to basically fill the appointments that they have. But moving forward, any other Virginia Mason related appointments are in partnership with the county and the sites at St. Michael's and in Bremerton, so Silverdale and Bremerton.
Okay, and so a patient who thinks he's going in next week to see his doctor thinks he might get it just by going to an appointment.
Correct.
A regular appointment.
Nope.
They're not going, right?
No.
And then I've been sending a few people to the senior center to fill out a form. For example, somebody who has no internet, no email. So am I getting it correct that you'll get to him eventually? He'll be 80 next month. And then the volunteer, Laura, will take care of making sure that person gets the second appointment. That person without internet doesn't have to keep contacting and doing anything. They'll eventually hear from Laura, right?
Yes.
And then
So
the third,
oh, sorry. I was just going to say, yeah. I mean, once we know that you've gone through one of the clinics that Bainbridge Prepares has, they and Mark Tan are prioritizing people, but we're assisting. And so once you're on our list and we've contacted you, and for many of you, we provide transportation to that clinic, you're on our radar. And so then we communicate with Lauren and say, okay, when are we going to do the Groundhog Day, which I think is a great way to say it, because I'm telling our volunteers that are helping us at the clinics, like, can you just put, the repeat day on your calendar so we can kind of just do the whole thing over again? So yes, if you go through and IVC has contacted you somehow and you get your first dose, just rest assured that we will get back in contact with you.
thank you. And then the very last thing, I've heard a lot of different websites and avenues. So me trying to advocate for other people who are being challenged, is there one main website to look to find out? I got mine in Silverdale, find out about the 2 places in Bremerton. Is there one main place to keep looking for updates about everything around here? Because it sounds like
So, Ann,
really the senior center for here.
Yeah, so the challenge is, so if it's Bainbridge, it's our website. And then if it's the county, it's the Kitsap County website. And so we have been advocating for the county to piece together all of the different clinics and locations and scheduling, and that might come together in the next few weeks. But unfortunately, because this is so disjointed, there really isn't one good place. So especially if anyone has the ability to go to King County when there's stuff in Seattle or go to Tacoma, like that is probably for the foreseeable future going to be your better bet. But St. Michael County test site in Bremerton, at this point, they are going to continue to receive vaccine and try to push people through there as well. So I'll put the county link in the chat right now.
And as I said, most of those links are also on the Senior Center COVID-19 information page, and they're also on Ann's page on the city, which we're trying to link them up. But the challenge is, yes, this is a community distribution program, which means that it's piecemeal and it's different in every single community. The other group that hasn't been mentioned here is Kaiser Permanente. They are also taking care of their clients, their patients. And I know people who have gone to Port Orchard or Tacoma and been recipients of vaccine through Kaiser at those locations, in addition to their more closely distanced places in Silverdale.
Yeah,
And-
so it
and I-
sounds like Bainbridge is pretty full, right? Bainbridge has big lists. So in helping other people, I should try to look on the county website and try to find and try to get them registered, maybe myself on my computer,
Yeah.
I guess.
Yeah, and Christine, I want to add something really quickly. So, and this is just an unfortunate reality. So we're on with a number of other providers on a weekly Kitsap Public Health call, and where basically Public Health asks us, how many of you would actually like to have your clinic listed on our webpage? And almost everybody said no. Like we can't do it because we are getting 1,000 phone calls right now. And we're getting 5,000 emails, and we can't we can't both do vaccinations for 100 people a week and respond to the 5,000 emails that we're getting. So we requested to be taken off the public health website. Member Plus requested to be taken off. Like just all the little folks like us. We're little, doing a few hundred a week. We just could not handle the inbound requests. And so that's one of the reasons why you're not finding some master list for the county. It's just one of those unfortunate realities.
So the biggest vaccinator right now in terms of multiple doses has been the county itself, Kitsap Public Health District, right?
No.
Oh.
No, they just started this week. Yeah, so it's actually been St. Michael's and Peninsula Community Health Services.
Did they start already, Peninsula?
Yes.
Because I thought, okay.
And where would you find out about Peninsula?
I know. I think they're one of the ones that wanted to be taken off the list. So again, you can see why this is very complicated. Lou and I are on that Monday call with the county every Monday night at 5:30. We will continue to share information as best as we can. I think the challenge is just there aren't really great answers for a lot of those questions. So the mass vaccination clinics will be publicized, will be on the news, the city ones will be on Nixle. We will do everything we can to get that information out to the community. But I know that doesn't, solve all the problems, but that is the reality for right now.
We're not trying to make it hard.
I know.
It's making our lives a lot harder, believe me.
Yeah, because there has been it gets back to this fact that there's been a very inconsistent supply and not a lot of warning. So,
And I was able to get on the Peninsula Health. I just Googled their name, which I think was Peninsula Health. You couldn't make an appointment on Monday. I think they maybe didn't have the vaccine yet, but there was a way to make an appointment. So just going on Peninsula Health Services, I think I did.
Okay. Well, sounds like that's a word of mouth situation. Eleanor, do you have a comment? And then I think we're going to have to let these folks go.
Yeah, you'll be happy to know I had a rant prepared because my frustration level is really high, but then I realized everybody else's was too, so why rant? But what would make me feel, it makes me feel a little better to think there's a list out there I might get on. The question really is, I'm 77 years old. They've jumped over my age range at least twice to allow other people in. That's the frustration. How long is it going to be before I might, I just, in the best case scenarios? I mean, are we talking, summer next year, 2025?
No, Eleanor, I'll take the first stab at that. So I would say that all the providers of vaccines were also frustrated that all of a sudden it went from more of a controlled 1A to, Governor Inslee's declaration, hey, if you're over 65, go for it. It's sort of like if you had a pizza restaurant and then all of a sudden the governor said, everybody gets free pizza, and it's just like, you can't, and then people are mad at you because where's my free pizza, and so we were, Jefferson County, for instance, was able to kind of do the step down, like, so 75 and over. Okay, it's still a large number of individuals, but more controlled. And then it was 70. And so that's when we were overwhelmed. It's everybody who was, 65, so 69-year-olds, banging on our door saying, the governor said, I'm ready. And so it was, it added to the customer service volume. Like all the providers, some of them were crying, like, saying, I can't handle all the phone calls. And so, but in terms of your question, no, I don't know exactly, Eleanor, when you're going to get your vaccine, but I would say that I would not be pessimistic to say like 2022. I would guess in the next 4 to 6 weeks.
And I would say the true worst case is that everyone in 1B1, so everyone 65 and over, will get vaccinated in the next 17 weeks. Because if we're getting 100,000 a week and there's 1.7 million in 1B1 in Washington State, you will all be taken care of in the next 17 weeks. Absolute worst case, assuming no new doses.
There's
Thank
more.
you. That's very reassuring.
There's one more question, I guess, from Robin on the chat. She's wondering, she has an appointment and she's wondering if there's a possibility that they might shuffle the appointments because to try to accommodate changes. Now, we don't know about how exactly CHI Franciscan is running the program, so we can't really answer her question in detail, but it seems unlikely based on the way things are going that if you have an appointment and there's a vaccine that you'll be bumped. The only things I've heard about is we gave you an appointment, but we never got a shipment. And so now we have to bump you. Is that the understanding from the rest of you?
Yep. Yep.
Yeah.
Okay. I'm going to give Katie a chance to get in here. I don't want to keep these guys too long because I know they're busy. Katie, did you have a comment?
Yes, sorry, very quickly, just a quick PSA. Please correct me if I'm wrong, Lauren. And so I just want to let people know that we will not be contacting people and asking for money in order to get the vaccine. So I know that scammers and frauds, I don't want to worry people, but I know I hear all the time that people get bombarded with very sketchy, fraudulent phone calls. So Bainbridge Prepares, the city, the Bainbridge Island Senior Center, Island Volunteer Caregivers, we are not going to be asking you for money in order to sign up to get on a list. We are not going to be asking for any money in order for you to get the vaccine. So just wanted to make people very aware. If you are ever asked to pay money up front, to send in a gift card, to give out a credit card number, that is fraudulent, and please contact the Senior Center or Island Volunteer Caregivers. And I am happy, I'm the community resource navigator, both with IVC and the Senior Center, and I'm happy to follow up with you and we can talk details from there.
And Katie, I would just add, same goes for testing. If you are going to a city or county open public vaccine or test site, right? Either they are free. If you have insurance, they bill insurance. If you don't have insurance, it's free. So if you come to the city for a COVID test, if you go to the county for a COVID test, there is not an expense for that. You go to a private pharmacy or you're traveling to Hawaii and you need a test, that's different. But if you're going to a public testing site, there is no fee. So no one should be asking for money.
I'd like to add two quick clarifying things, Katie. So when you do come into our clinic, community pharmacy is allowed to charge a small administrative fee of, I think, around $20-25 to insurance or to Medicare. Again, you won't be directly billed. It'll go through insurance or Medicare. But basically, that's the only small dollar transaction that may occur throughout all this.
And if you don't have insurance, then the federal government has promised they will pay that fee. And it's up to Mark to figure out how to bill them.
I will say this, Mark. Mark in community pharmacy is essentially that $20 fee is not covering the outlay that that, I mean, all providers are essentially, none of them are making money off this endeavor. $20 fee does not cover the extra syringes and the cotton balls and if they're renting out space and extra, overtime for their staff. And so Mark and his team are really doing it as a community service rather than to make any sort of profit. The other thing I'll say is that does not say that you can't bring cookies to the volunteers when you arrive for your vaccine. So you won't get you in the queue any faster, but when you do arrive, some chocolate chip with nuts or without is perfectly acceptable.
Okay, I want to note that this is a collaborative effort. Bainbridge prepares. We heard from Lauren Bast, the city of Bainbridge. Lauren, thank you. Ann Lesage from the city of Bainbridge Island. She's the emergency coordinator there. And she looks forward to getting back to us being prepared for earthquakes and other catastrophic events like that. Bainbridge Island Community Pharmacy, Mark Tan there and the whole crew. The Medical Reserve Corps, which I think Andrea Chimey and David Cowan are the leads of, have been doing yeoman work. Island Volunteer Caregivers, Laura and the whole team there, Robin and Katie and Lynn and everybody. And the Bainbridge Island Fire Department.
Center, and the Senior Center.
Thank you. And Deputy Chief Markovic at the Bainbridge Island Fire Department has been working very closely with this team as well.